but they're credentialed to provide primary radiology healthcare services with physician supervision. And I say with physician supervision with some great stress, because there is some factors that determine whether they need to be supervised or whether they do not, depending on location and what those levels of supervision are. Those will vary from state to state, and the hospital actually has a pretty big play in supervision as well, hospital rules. So they are certified. They have their own board. So it's a certification board for radiology practitioner assistant. Their education is very large. They learn how to do a lot of what a radiologist does in their normal day, including invasive procedures and non-invasive procedures. They learn how to do communication professionally, and a lot of what RPAs are utilized for in today's practices is to talk with the patients, educate them on procedures, complications that could come from that, take care of the patient afterwards, determine, kind of do that pre-op, is there any comorbidities, taking care of problems afterwards, calling in other specialists if they need to. But they also learn how to do fluoroscopic procedures, evaluate images. They also can do non-vascular invasive imaging. They learn medical ethics and law and risk management. The services that an RPA can perform are widely vary from state to state, and that is something that I would urge you to check your state policies and make sure that you're within the role, and then also check with the hospital that that person is going to be working within, or it could be a freestanding clinic. A freestanding clinic I can give you definites on. As far as the hospital goes, that is up to JOPCO to be able to determine what an RPA can perform there. But they do decision-making in the role of a primary caregiver. So they can do the patient assessment, the management, and they can also provide a broad range of medical imaging and interventional services. In the clinical role, they do primary and specialty care in rural and urban settings, and this is defined by the supervising physician. The clinical privileges and authority of any physician extender, which is what an RPA is, it varies by state and by billing insurance carriers. So each practice should verify the rules and regulations governing its own jurisdiction. Professional credentials, these are basically the same. They are a radiology technician and a radiology practitioner assistant. You most often see it located behind their name as listed by the second bullet. Their code of ethics is very similar to a physician's code of ethics, not quite as detailed, but they do have quite a bit of things that they need to adhere to. So they have to adhere to all the state and federal laws and get informed consent regarding the patient, so that they need to do that discussion with the patient. They can seek consultation with the supervising physician, other health providers, qualified professionals that have the skills or knowledge or expertise that they need in order to benefit the patient. They provide only those services for which they are qualified, and they have to demonstrate clinical competency in order to provide those services. They cannot misrepresent in any manner their education, experience, their credentials, identity, and sometimes this one kind of goes a little under. Some people think that when someone walks into their their hospital room and they're wearing a white jacket that it's a doctor. And it needs to be explained that, I'm not a physician, but I am a physician extender, so I'm helping Dr. A to prepare you for your procedure today. And they have to place the service before material gain and must carefully guard against conflicts of professional interest. Supervision rules. This can be found on your Medicare carrier's website under the physician fee schedule, and it's the payment policy indicators that you want to click on that button to bring that up. What they generally are, there's a 1, a 2, and a 3. 1 is general supervision, 2 is direct supervision, and 3 is personal supervision. General supervision are procedures that are furnished under the physician's direction and control, but the physician does not have to be physically present. They have to be there and be made available to review the practice of the RPA, make sure that what they're doing is correct, to provide consultation services. So if the RPA believes that a patient should have a procedure done or a more invasive procedure done, that physician needs to be available so that they can consult together and decide what's going to happen, what to go ahead with. They need to be there to review the records and to educate the RPA. So the radiologist is basically there, and this is something, an example would be an electrocardiogram. If, the RPA is reading an electrocardiogram and maybe has a question, something looks very abnormal or does not look right, the physician needs to be there so that they can discuss that and then go back and provide appropriate treatment for the patient. Direct supervision it applies to services other than just your diagnosis